Hi all, good morning, good afternoon, and good evening to some of you. My name is Meni Shikhman. I am the Vice President of Business Partnerships here at Taito Care. I always like to start with our mission. The company was founded in 2012 with a vision of transforming the way primary care is delivered, essentially removing the need for a doctor and the patient being in the same room without compromising on quality of care. And that puts us in the telemedicine industry. As you probably know, the pandemic accelerated the adoption of telemedicine around the world. Consumers became more aware and more open to adopt telemedicine as a paradigm for care. Governments removed barriers and restrictions, adopted favorable reimbursement practices. We see it all over the world in the different countries we operate in. So with all this positive momentum that was generated by the pandemic, still there is a major issue within the telemedicine industry, and that's the almost non-existent adoption. But now, as we're starting to emerge from the pandemic, even though the percentages are slightly higher, but as you can see in the chart on the left-hand side, still the adoption is very low. And what that essentially means is that people are just not trusting telemedicine, either a phone call with the provider or a video, as a way for them to receive quality care, simply because they know that they cannot replace a face-to-face visit. And I always like to bring my own story here. I have a 6-year-old. If he wakes up with a pink eye, I can self-diagnose him, and sure, I'll call a doctor to get my prescription drops. But if he wakes up with a cough and a fever, unless a doctor can examine him, there is no way I'm going to trust any doctor over a phone or a video. And this is exactly where TytoCare plugs in. We essentially build that trust between the consumer and the provider, and I almost see it as a puzzle. And the puzzle has several pieces. It's a challenge to solve, and Taito is effectively solving it. One, we have a physical device, not just an app on your phone. It's not just a gadget, it's a medical device approved by the regulatory agencies in the countries we operate in. With its capabilities, it replaces most, if not all, of the exams that are typically done by a provider in an office visit. And last but not least, and maybe most importantly, the providers that are providing the services through the Taito platform are renowned providers in the markets that we operate in. We really see Taito Care as a home appliance. It's serving the entire family, not just the patient with some sort of a chronic condition, but it's good for patients with chronic conditions, for the entire family that has primary and urgent care needs, and it drives adoption of telemedicine utilization, as well as depth and breadth of use cases that can now be served through virtual care means. We have several product offerings. Some of them are designed for the home, serving primary urgent care as well as chronic care needs. And we also have our professional line of products designed for clinician-to-clinician interactions, serving visiting nurses, long-term care facilities, schools, ambulances, and many other use cases. Just some quick snapshots of results. As you can see, I'm repeating the same statistics around the utilization of telemedicine for the industry and then Taito-driven utilization. You can see that we are dramatically higher in adoption and utilization, both before the pandemic, during the pandemic, and now as we're getting out of the pandemic. And utilization of telemedicine translates into cost savings. So it's a very simple equation. If telemedicine is used, is saving money. And then in addition to cost savings, there are intangible benefits. So patient satisfaction, physician satisfaction, bringing in new patients, and creating the feeling of sort of the safety and convenience that telemedicine can provide. These are some of the intangible benefits that Taito Care generates for the customers that we serve. A little bit about our vision, and I'll stop in just a minute. Taito Care always marches forward and develops more and more capabilities. Currently, the telemedicine industry is at level 1, sort of its traditional phone or video calls. Today, Taito Care with our customers can already bring telemedicine to level 2 and level 3, asynchronous modes as well as asynchronous plus triage capabilities. And we are marching fast forward to get to AI-driven decision support and self-diagnosis. Next slide, please. And this is an example of one of the algorithms we're going to be releasing in the near future, where Taito Care will be able to provide decisions. Next slide, please. Decision support for providers, advising them on specific conditions and pathologies that we can identify using our unique data sets and machine learning capabilities that are developed by our data team. Just a quick summary of our traction over the last year or so. We are active now in 18 countries. We have about 160 health organizations working with us, ranging from insurers to large provider groups and hospitals, all the way to self-insured employers here in the US. Just last year alone, we conducted about 600,000 tests and exams on our platform.